So a lot of women suffer from incontinence starting at a very young age, but have a difficulty talking to their doctor or bringing this up. I think if more women realize that that is also a muscular controlled function that we could really aid with helping, we've seen some excellent results, even to the point where people no longer needed to do additional surgery for that.
So a lot of people will ask if they're the only person that leaks when they cough or laugh, or they'll also say that they think it's normal because on TV there are a lot of commercials that have normalized incontinence. Or some people will say, you know, I've had 4 kids, I just thought it was normal that I would have pain with intercourse or that I would have leakage. But that's actually not true, and we're here to kind of give them some more information and help them get their life back. So the pelvic floor is a group of muscles that sit in the lower pelvis. They aid in urination, defecation, and sexual function, and they also help to support the pelvis, the hips, and the low back. So sometimes patients can come to me with issues where their pelvic floor is weak. So these patients may complain of leakage of, say, their urine when they cough, laugh, sneeze, jump, or exercise.
So the whole focus of incontinence, whether it's postpartum or with aging, is to learn where those muscles are and how to contract them. We try to tell people to imagine the pelvic floor muscles as being a sling that basically is there to support your internal organs. They're also there to function to prevent leakage from the urethra, which is what's going to be emptying the bladder. So women develop incontinence. So what we're going to do is focus on this sling of muscles, teach them where are those muscles.
Usually I'm going to cater a program to the specific needs of the patient. So depending on what I found with their alignment, I may do some corrections to that. I may do some soft tissue work or massage type techniques to those muscles. So I may have the patient do exercises where they are coordinating their pelvic floor muscles with their core muscles, with their breathing patterns. And then there's also something called biofeedback, which we can utilize, in which an electrode is inserted into the vagina or rectum, and then that gives a readout onto a computer as to what the muscles are doing.
I often explain it's similar to an EKG. An EKG is showing you what the heart muscle is doing. Our screen is showing you what the pelvic floor muscles are doing. So it's not creating any type of current, but is showing us, giving us a picture of how the muscles are responding, and then teaching them, watch this screen, and as you see that you're able to make the screen have a higher level of contraction, the dial is going to go up higher. So it's a good technique. So our whole focus is on the pelvic floor.